My dear friends, today I have planned to discuss regarding our one of the modules which is very important for the every hospitals, every clinics as well as individual doctors. Okay, so before I want to explain everything about our product to our customer so that he will have better understanding before purchasing our product. This product name is the DVNA OPD management software. OPD means OPD, the full form of OPD is outpatient department management software. So let's I am going to explain you what is OPD. Outpatient department. Outpatient departments means कि whenever patient is coming to the any healthcare organization like hospitals, clinic or individual doctors, then that times patient is coming the doctor and he is explaining everything to the doctor and getting the suggestions and prescriptions. So that's why it is called OPD. Okay. So, according to this digital technology, this OPD management software is required. So, before and we are providing the services of OPD management software. So, before going to forward, I want to explain you everything and every features whatever available till now this DVNA OPD management software. Okay. So just I'm going to there, so just let out. Okay, so this is our home page. Okay, so I'm just going to, it will ask you the username and password. Just I'm going to there and putting the username and password. After putting this, it will open the content page. Now let us come there, what is there and what needs to be explained to you. So okay, so in our modules DB and OPD management softwares, this will be the, I will explain about you the patient registration. Patient registration is the very common features that should be available, and this is available to the our modules DB and OPD management softwares. Okay, so patient registration is that collect the information about the patients. Okay, so just I am going to there. So this is the overview. Let's see, I'm going to patient menu and then here this is the patient registration page. Okay, so here this is the patient registration page. Patient registration means you have to collect some minimum information about the regarding the patients like first name, last name, full name, mobile number, email ID, date of birth or either age, a father's name, state, city, address, alternate mobile number, his gender information like patient is male, female, like this. So this is called the patient registration. So what is use of this patient information, patient registration? So patient registration is keeping the records of the patients. Okay, and this registration is the one time registration. So during this patient registration, so some of clinics it will take you the charges. Okay, and some of the clinic are not getting the charge, not taking the charges. Okay, so from there, so there are two kinds of patient. One is the already registered patient. So just I am going to there, I am searching there. Okay, so after putting this is the search character, whatever the name of the patient. So first letter of that name we will put here, then it will give the full name of the patient. And then accordingly, just I had got this, so I have selected this ones. So after selecting this one, it will give the registration ID of these patients. Okay, so just I am going to there and selecting the registration ID. So after this selecting the registration ID, you will get the entire information of the patient. So if you are getting the such kind of information from the existing database, so this is called the existing registered patient. Okay, so suppose you want to the register new patient, then you have to go there the new patient. After clicking this new patient, it will options. So okay, so whenever the patient is not exist, then you have to put the first name like this and last name, and then you have to give the mobile number, then you have to give the age. Okay, then you can give the, if you know, then unknown, I not know. Okay, so after putting this, you can put the, if you know the address, then you can put there, otherwise you can put like this, like this. Okay, so in this way, after putting this information, you have to click on the save button, so it will register your save. Okay, so I have explained many things is there. Okay, then you can also search the existing patient. Okay, so this is the one of things is the patient registrations. Now one more things is the patient queue page. Okay, so just I am going to click on the close. After putting the click, just go to there. So one more page is the patient queue page. What is the patient queue? Patient queue means whenever patient is coming to your clinic or hospitals, then that times when they will show the doctors. So this kinds of making a line is called the queue. Okay, so this queue is going to managed by this patient. If you will so this is the patient queue page. Okay, so from this patient queue page you can manage the patient's queue number. Okay, so here you have to put the appointment date. Just I am going to putting this appointment date, and after putting this appointment date, then it will show you the doctor's available time. According to this available time, you can fix up the appointment like 10 10 suppose I am putting the 10 10 10 10 20 like this. Okay, so after filling this, then we have to click on some here hatch cam. Okay, just I'm going to click. So let's why it's so I have explained you the patient registration, patient queue. So one more thing is the doctor panel. What is the doctor panel? Doctor panel is that from there. this panel has access to the doctor. Whenever doctor will come and it will log into the software, then it will show him his patient queue. So there are many queues. One is the individual doctor queue, and the other one is the everyone doctor queue. So, okay. So if a doctor will log in, then it will show the doctor queue, matlab that doctor's patient list. If receptions will log in, then it will show the many things. So just let me, I am going to there. So from there doctor menu you will get the doctor panel. Okay, just let them come. So this is the doctor panel. So this panel has many things. From there you can putting this date. By putting this date it will show the appointment, and by putting the doctor's name like this, selecting doctor name, then this, then you have to put the range like from date to date. Suppose I am putting the for uh, from this date to this date, then after clicking this it will show the list of patients like this. So here this is the patient queue list and this is the patient visited list. Patient queue list means the patient which is already queued but doctor is not consulted. Yeah, doctor consultation has not completed yet. So this is called patient queue list. And patient visited status means, so whenever doctor visit is completed, discussion is completed, so this list of the patient is there. Okay. So here by using this panel you can monitor the patient status or patient queue number. Okay. So these were there, and now I'm going to there. So this is the patient visited status. So in this patient visited status you will see there the patient visit status like in progress, completed, cancelled. Suppose patient visit is in progress, then you have to keep the selection of this in progress. If patient visit is completed, then you have to click on this completed. And suppose patient queue has already taken but patient has not came yet and patient want to cancel his appointment, then that times you have to select the cancels. Okay. So in this way you can manage the patient visit status by using patient visited page. So now let's go there. Okay. So I have already explained the patient registration, patient queue number, and doctor panel. Just I am going to there the prescription. Okay. So in this module, so this is the doctor prescription. So I came there and this is the format of the doctor prescriptions. Okay. So let's, I am going to close this one. Okay. So I am showing you the some good example of the prescription. So let's see, I'm going to some other models like this. So please wait on. So now I am coming to just going to explanation about the doctor panel and prescription generation model part. Okay. So let's come there. So these are the features for our DVNA OPD management software, And I will also explain you about the doctor nature of service mapping and doctor fee configuration. So exactly what is the doctor nature of service mapping? This means in your hospital or in your clinic or whatever the healthcare institute, they are the some nature of service, like doctor is the general physician, gynecologist. So how will you map this doctor to those features? So this will come cover in the mapping of the doctor of mapping of nature of service. So what is nature of service? Nature of service is actually the configuration item. And doctor fee configuration. Doctor fee configuration means some doctors have consultation fee 1000, some doctors have consultation fee 500, 400, like this. So this fee configuration will cover in the doctor fee configuration. Okay. So after that we will discuss on the reporting part. Reporting part means patient queue history part. Reporting part means show how much money your clinic has collected today. Yeah, how much patient has came today, how many queues are this came today. So many reports is there that I will explain in the reporting parts. Okay. One more things is there, the vaccine billing. Vaccine billing. What is the vaccine billings? Vaccine billings means some child has coming to only taking purpose of the vaccines. Okay, so you can also manage the individual billing of the vaccines by using this software. So there is a facility also, the vaccine billing facilities. Okay, then so I think you better understand the vaccine billing. And this is the user creation. User creation means, so we you have found the softwares in the market, so they will give you the access uh, and also charge the money for your software cost. So the restriction of users, so in our software there is nothing restriction of, you can create unlimited number of users. Suppose you want to create user 1, 2, 3, 4, 5, 6, 7. Yeah, how many staffs is there? So you can, by creating this user, you can manage the all staffs. Okay. Now we will come to their the patient history. Patient history means, so if any doctor that have the good experience, so they will examine the patients and they will understand the patients, and after understanding every history of the patient, they will start the treatment. So for such kind of doctors looking for patient history. Okay, so that's why patient history is important, and this feature is available in our software, and I will explain you, I will show you this patient history. So what is patient matlab family history? What is the family patient history? Then I will explain you, I will show you the female, some gynecological doctor has required the gynecological, so they want to maintain the records of the whatever patient they have uh, taken care or they are treating. So in this gynecological history you can manage as a patient history, and also for the better treatment, illness from which family members, some genetic disease yeah, like this. So from there you can also manage the patient history. Okay. Now one more things is that will cover in the patient history. Patient currently being treated, which kind of disease, yeah, which kind of things that needs to be treated, yeah, that are going to the treated. Okay. And then patient has to be treated in the past. So in the past, like one year ago, 2 year ago, 3 year ago, 5 year ago, whatever these. So what kinds of treatment the patient has taken. Okay, then after that patient medical history. So this software also taking care about the medical history of the patients. Okay, so patient surgery history. So whatever patient have taken care surgery in the future and they have already taken care. So this kind of, if you want to maintain this such kind of the information, then by using DVNAOPD clinic management software, and you can keep the records of that patients and social and preventive history. So actually these history will helpful for the doctors for better treatment. Okay, now I'm coming to there. Just I'm coming to there. So I will just coming to there, and I will show you the prescription parts. Let's see how prescription is going to be generated. And suppose you want to use these softwares. By using these softwares, how will you generate the prescription, and how will you take the printout of the prescription, and how will you manage the prescription? If you want to update the prescription, so I will explain you, I will show you the things there. So now let's I'm coming to, I have already explained you the doctor panel. Okay, now I'm going to the prescription models. Okay, so let's see, this is the another models. So I'm going to there, just I'm going to there and putting the login ID and passwords. So I'm going to doctor panel. Okay, like this. Then I'm going to selecting the doctor name, its registration ID, then going to there, just click on the view, and then it will show you there. So how patient which, whenever you will click, then it will give the information about the patients and doctors. And then here every parameters you have to fill. Okay, like allergy history, like medical history, yeah, examination, physical examination, or systematic systemic examination, and chief complaint, like whatever patient has complained, that needs to be filled up there. And whatever systemic examination, so it will cover by the doctors. So doctor has better understanding, because they are highly qualified, and they are knowing the everything in this industries, but we are only the developing of these software. So okay, so here these things is here lab test. Okay, suppose you want to give some test, then from there, so this is for the selecting the test, and this is for this module is that selecting for the medicine. Okay, like this. Suppose I'm selecting this syrup like this, and we have to put the name like so then it will ask the dose means one, other like this. Suppose I'm selecting this. Okay, so in this way you can fill and recommend the medicine. So this is not our part, this is the doctor parts. And just going to click on update. So after doing update, then it will automatically generate one prescription. Okay, so by clicking this, then it will give you the prescription. Okay, so in this prescription, this will be the patient information, this will be the chief patient claim, complaint, and this is the physical examination, and this is the systemic examination. Okay, and here is the medicine name and doses. Whatever you will do and select on that, that will the come there. Just I show you the format of this prescription. Okay, now I'm coming to there. Just I have completed the doctor panel prescription generation. So I have shown you how to generate the prescription. Now coming to the doctor nature of service mapping. Okay, just I'm going to there, I'm closing. Just I'm going to there and go to the now I'm going to click this model. Okay, now I'm coming to the previous one. I have shown you prescription from there because this is the new and updated version. Now I'm coming to just wait. Okay. So now I will come there regarding how nature of service mapping is work and doctor fee configuration. Okay, so let's begin. Okay, I am going to there. I'm login. So here in the doctor menu, so one more is the doctor nature of service mapping. Nature of service mapping is that like which doctor is what kinds of specialist. So from there this page will open, then here you have to select the doctor name like this. After selecting this doctor name, it will automatically through your the doctor registration ID. After selecting this registration ID, if doctor nature of service is already mapped, then it will show here like this child especially this is the already mapped. Okay, so just I'm going to there. Okay, so this is the already mapped. Okay, so this was the doctor nature of service mapping like this. And now just go to there. So I have already shown. Now I am coming to the doctor fee configuration. So doctor for going to doctor fee configuration, you have to go there, administrator menu. I'm going to there, administrator menu, and then going to doctor registration. So it will open the doctor registration. Okay. So this is actually my doctor registration. What is from there? Whenever new doctor will come in your hospital, then first of all, you have to register this doctor information. Okay. Now click on the next. So after clicking the next, then it will come to the doctor qualification. Just I am going to click on this. Then it will show you the doctor qualification. Now going to next. Then it is doctor of nature service. Going to next. Okay, I've already discussed regarding this. Just I'm going to next. Okay, so here we have to search the doctor. For which doctor we need to configuration the doctor fees. Okay, so whatever doctors will be there, that will show there. Okay, now after putting this, it will give you the registration ID, doctor registration ID. Then according to requirement, doctor nature of service, just I have selected the physician, then it will show the every information. Suppose this doctor has like doctor OPD fees is 400, IPD fees is 500. Okay, so from there whenever new doctor will join, then from there you can configure the doctor fee. So if you want to change like 400 to 500, 500 to 400, so then from there you can change it. Okay, so now I have shown you the doctor fee configuration. Now I'm coming to the reporting section. Okay, just I'm going to click. So here I'm going to reporting section. So in case of the OPD, you have to give the range. Like I am just for example for demo purpose, I am putting this range: 6 June 6 2022, 7 July 25. By default, it will show you 1 month. Okay. So here you will be able to see the doctor registration fee details. After clicking this, it will show the doctor registration fee details report. So like this. Okay, now I'm going to patient queue fee details. Suppose how much money has came by patient queue, then from this report you can get the every information like this. Okay, so you will get the total amount. Now patient queue. Then from there you can check the how many patient is going to be cancelled. So this report also show you there. So as per demo data, there is no any cancels appointment. So that's why it is showing the black. Okay. Now I'm going to the patient registration fees detail. Suppose your clinic, yeah, your organization is taking the registration charge. Then from there you can fetch the report of patient registration. How much money has came from the patient registration fee. Okay. Now I am going to explain just like patient queue history. Okay, so this is the patient queue history. Suppose we want to search the patient that name begins with A. Then after that I am going to there. After selecting this, then it will give the registration ID. So after this registration ID, it will generate one more reports, that is called patient history reports. So if you want to see the patient history when they have came, and how many times they have came, and how much money you have earned from this patient queue, then you can see from this report. Now I'm coming to there. Now I'm going to some parts, that is the vaccine billing and user creation. Okay, so first I will go to the vaccine billing. User creation I will show you the later. So just I am going to the vaccine billing. Okay, so here one more menu is the vaccine menu. From this vaccine menu you have to go to there, and after clicking this, then it will, I have to search the patient name, and after putting the search character it will show the patient name. After selecting this patient name, it will show the registration ID, and then after selecting this registration ID, it will show you the QID, for which QID you want to do it like this. Okay, so after Q selection, then we have to select the vaccine name. So right now there is no vaccine name is configured, that's why it is not showing, but you can make the billing from there. Okay, and this will work in this way. Okay, now I'm coming to the next part, user creation. Actually, what is the user creation? User creation means in the for using this software some users is required. Okay, so by default we will provide you one user, that will be the administrator user, and after selecting this, so from there you can define the roles of the every users. So here this is the login creation grid. Okay, and change permission grid. Okay, so here there are 4 users. Mhm. Okay, just click on the view here. So from there I'm going to click on the search. So after putting this search, this user ID is demo user ID is the administrator user. So here it will show the list, and these are the permissions levels. So first level highest administrator is the highest level privilege, then doctor, for the doctor users, then this is the doctor privilege, this is the reception privilege, this is the HR model privilege, and this is for the staff, and this is the disabled. What is a staff? A staff means if you, any user, any people is coming to in your hospital as the as a worker, as an employee, then by default if you don't know the anything about his work related, then you can by default put the staff. And by creating this user ID, so why staff is user ID is the lowest privilege for this account, for these softwares. So they don't have many things privilege, they don't have everything access, they have only few things is access. Okay, so this is the staff. Okay, and administrator role is the highest privilege role. Suppose you have created one user and you assign the administrative privilege. Okay, so after putting this administrative privilege, they will able to do everything in this software. Okay, now I'm going to click on the close. Let's see, I'm going to there. Okay, so I have already explained you about the user creation. So now I'm coming to the patient history. Okay, so from this just go to this menu. After going to this menu, we are able to see this patient history. So I'm going to there. First I have to go to the patient history, family history. Okay, so like this I'm going to the family history. So after clicking this family history, it will open the form. That form will be, this is called a family history grid. So why it is grid? Because of the whatever list of patients that has came for the OPD visit, so that will this will show. So just I am going to this patients. Okay, so after clicking this, so here from there you can manage the family history. Family means this is the patient information, this is the mother information, and living status, mother's age, mother living status, father. So this is nothing related to this. This is for only for the information purpose. So this is called the family history report. So after filling this, you have to click on the print. Then you can also get the report of this family history. So we have not given any information, any data. That's why it's coming to like this. But whenever patient's family history required, then they will fill this form. Okay. So I have shown you the family history form. Okay. Now I'm going to the next. So after family history, one more history required. This is the female. This is for the female uh, patients. Okay, so I'm going to there. I am going to female gynecological history. Clicking on this, then it will open the page. So this page is called. This is the list of patient, and if you click on this, then it will show you the what kind of information that is you can keep. Okay. Like this information you can manage. So in this way this was, and I'm just going to the illness form. So this is the illness form which for family member great. Okay. Now clicking this, it will show the complete form, and from there some disease name is there: anemia, yeah, blood disease, cancer, diabetes, glaucoma, head, high blood pressure, HIV, like this. So these information uh, you can manage from this form. Okay, I am not putting any data, just I am showing you the features. Now I am coming to another where we have reached. Okay, illness. Now I am going to the patient currently being treated. Okay, so now patient currently being treated. This is the patient currently being treated for. This is the patient list, and click on the view. Then it will show you the form. From there you can manage, yeah, maintain the patient currently being treated information. So this is nothing. This is the patient history part. I'm going to click. Now I am going to there. Now patient has been treated in past. So I am going to there. Patient has been treated in the past. So after clicking this, it will show the list of patient for which patient you required this. Then you have to click on that. So after clicking this, it will open one form. Okay. So so patient has been treated in past. So for this, any kind of these are the disease name. If they are treated, then you have to put the information and then save. Okay. Now patient medical history. Let's see. Just I am going to click and close. Then we are going to patient medical history form. So from this history menu, you will go to the patient medical history. So after clicking this, it will open, and then put the every information regarding the patient medical history. Like many things is there. So these question answers, yeah, some. So this required for the better treatment, and it will be managed by your doctors. Okay, so this is called the patient medical history. Now I'm going to patient medical history, patient surgery history. Okay, then now I'm going to there and going to surgery history. So from this form we can manage you can manage your doctor's patient surgery history. So in this way you can keep the track, yani keep the every information regarding the patient which are under you. Now I'm going to clicking and patient surgery history is complete. Now social and preventive history. So I'm going to the history and see click on the social and preventive history. So this has come. So this form is only for the patient history, and this will be used by the doctors. Okay, so this is the social. So in this way, from DVNA Softec Private Limited in DVNA OPD management models, you can manage everything and this such kind of the features. But many features, so we have some limited times, and we want to keep some less timey demo. So we have left many features. If you want to know more details about this, and you want to practical demo on this, then you can contact us on our website dvnasoftech.com. So from dvnasoftech.com you can get this information, and directly you can call on this number. They will be able to help you everything. So now little bit I am coming to our view that hmm, so many customer has question is that this software is online software or offline software. So I am telling you that this software is supporting both modes. If this depends on the implementation parts. If you want to host this software in the cloud infrastructures, then you can also implement in the cloud infrastructures. It also supports the this software is also support the IBM cloud. This software is also support from the Azure cloud, like this. So whatever service provider. And now how will you purchase these softwares? These softwares is you can purchase from directly from our company, or you can purchase this software from our consultant also. So if you want to little if you want to more information regarding this, and this software is also as per your requirement and as per your convenience, you can also customize these softwares. But this customize for this customizations you can contact us. Okay, so we have completed today detailed information about our OPD management features and things. So that's all. Okay, thank you dear friends. We will meet you some other video sessions. Thank you. Okay, bye.